How do vegetarians understand bone density test results? Imagine sitting in your doctor's office, holding a report that shows your bone health. If you're a vegetarian, you might wonder what these numbers really mean for you. Bone density tests, like dual energy X-ray absorptiometry or DXA scans, measure how much mineral is in your bones. They focus on key areas like your lower back and hip. These results help determine your risk of fractures and osteoporosis. Some studies show vegetarians tend to have slightly lower bone mineral density compared to people who eat meat. For example, vegetarians might have about 4% lower bone mineral density in certain areas. Vegans, who avoid all animal products, sometimes show a little more reduction. But these differences are usually small and don't mean you will definitely break a bone. Many factors influence these results. Body mass index, which is your weight divided by your height squared, plays a role. Vegetarians, especially those who eat raw foods or are vegan, often have lower body weight. Less weight means less mechanical stimulation on bones, which can lead to lower bone mass. Your diet is another big piece of the puzzle. Vegetarian diets are rich in nutrients like potassium, magnesium, vitamins B6, B9 or folate, and vitamin C, which support bone health. However, they might have less protein, vitamin D, calcium, and vitamin B12. These nutrients are key for keeping bones strong. Vitamin D and calcium are especially important for mineralizing bones. If your levels are low, your bones might become weaker over time. Some vegetarians have higher parathyroid hormone levels, which can indicate subtle differences in calcium metabolism. When vegetarians look at their bone density results, they consider these factors. A slightly lower score might lead them to check if they are getting enough calcium and vitamin D. They might think about taking supplements or eating more fortified plant foods. Staying active with weight-bearing exercises like walking, jogging, or resistance training is also helpful. These activities stimulate your bones to stay strong. Vegetarians can improve their bone health by eating calcium-rich foods like fortified plant milks, leafy greens, and tofu. Monitoring vitamin D levels is wise, especially if you don't get much sun exposure. Regular exercise and a balanced diet help maintain bone strength. If needed, talking to a healthcare provider can clarify what your results mean and suggest personalized steps. They might recommend blood tests for vitamin D or calcium levels. Overall, vegetarians interpret their bone density results by understanding how their diet and lifestyle influence bone health. Even if their numbers are a bit lower, they can take simple actions to keep their bones healthy and strong.